Hello everyone, I am Dr. Esha R Shanbhag, a gynecological oncologist at Aster International Institute of Oncology, Whitefield, Bangalore. So the 5 cancers which every woman must know. So every year thousands of women are suffering from cancers of the reproductive organs. So the 5 cancers, mainly the cervical cancer, the ovarian cancer, the uterine cancers, the vaginal and the vulvar cancers. So each of these cancers have their own warning signs, but all share one truth, that the earlier we find them, the better is the outcome. So coming to each of these cancers, the cervical cancer. So this is the cancer which is the only preventable cancers. So it's one of the rare times where science has given us the opportunity to completely eliminate the disease. And how do we do that? It's by a simple vaccine, the HPV vaccine. So this vaccine, when given to adolescent girls and boys before the sexual encounter, we can completely prevent the cancer from happening. Next is the pap smears, the HPV test. So these are like safety nets. So we catch the disease early, prevent the cancer from happening. So we know actually our body is very amazing. So it gives a lot of alarm bells. But what happens is we ignore the whispers until it turns into echoes. So there are a lot of warning signs which we need to be aware, like the ovarian cancer, which is often silent, but if there's persistent bloating sensation, you have persistent tummy pain, you're feeling full with even eating a little, you have disturbances persistent with passing urine or while you're passing motion, please never ignore it, go to a doctor. Similarly to the uterine cancers is any lady who's postmenopausal. If she bleeds, no matter how small it is in quantity, whether it is a spotting or how infrequent it is, never ignore. We need to evaluate it, and that is the earliest sign of a uterine cancer. So lastly, the vaginal and the vulvar cancers. So you have to look out for persistent non-healing sores. If there are lumps, if there's itching, we need to identify if there is any cancers in those. So usually the gynec health or the women's health is considered a taboo subject, but it's high time we change it to talk. So talking is the first step towards treatment, and treatment works better, the best, when we identify it early. So the key step here is to be aware and approach the doctor at the earliest. So if you have any further queries, you can always come visit us at Aster Hospital, Whitefield. Thank you.